limiting illness has been published. The research commissioned by two children's hospices has found that 1 in every 172 under 18-year-olds here have a life-limiting condition, and it's a figure that has increased by a quarter over the past 10 years. Those behind the research say demand will continue to rise for their services and are calling for more financial support. Stephen Fairclough reports.
Ciara is 15. She lives in Welshpool and has a condition called agenesis corpus callosum. Part of her brain didn't develop before birth.
She's non-verbal, she's got low cognitive ability, she's got epilepsy, cerebral palsy, amongst other things.
Like thousands of other children with life-limiting illnesses, Ciara needs specialist help and respite, which she's able to get from Hope House, Gobaith.
They've been there when Ciara contracted meningitis when she was young. They were there when my wife passed away 6 years ago, and so they've helped us through a lot of big life events.
Today in Cardiff Bay, Ciara and Dylan helped the Children's Hospices of Wales launch the first research of its type into 10 years of data about children with life-limiting conditions in Wales. The research found 1 in 172 under-18s have a life-limiting condition. That accounts for 7 out of 10 of the children using paediatric intensive care beds. And 2 in 10 of all hospital inpatient beds are taken by children with life-limiting conditions, and the demand is expected to grow.
The number of children with life-limiting conditions in Wales is increasing, and the complexity of their medical condition is increasing as well. We need to know those numbers. We need to be able to articulate the importance and that need to politicians, to policymakers, and also in terms of how we plan as a system to ensure that every child and family gets that support.
The services provided in the peaceful surroundings of Haven and Gobaith, providing respite and end-of-life care, are really valued by the children and families who use them. They also help to reduce strain in the NHS, but those who run them say they need more funding.
Haven particularly is funded about 11% by the Welsh Government, and that's fantastic, but again, it's the tip of the iceberg when it comes to the kind of costs we have. Our care costs alone per year are £5.2 million, so that's huge magnitude, and we're asking the same people in Wales who are already dealing with the cost of living crisis and the energy crisis and mortgage escalation to support us. So really we need sustainable funding.
The Welsh Government says it provides £10 million worth of support every year for palliative services, and it knows that children's hospices are facing increasing challenges, and it says this report will help it decide where funding priorities should be in the future. Stephen Fairclough, BBC Wales Today, Cardiff Bay.
The funeral of two